Alrighty, hello everybody, and welcome to the Babies in Common videocast and podcast. We're having a great conversation today with Jill, who will be introduced momentarily by Melissa, talking about postpartum depression and anxiety. I'm Jeanette Mesite-Frem, the owner of Babies in Common. I'm an internationally board certified lactation consultant, childbirth educator, mostly retired birth doula, and I have 2 teenagers. And Melissa.
Hello, I am Melissa Ann Dubois. I'm a registered nurse and childbirth educator and certified lactation counselor. I've worked in all sorts of hospital and office settings in the OB/GYN field. I'm also the mother of 3 small children.
Awesome.
Hi, I'm Jill Fieleke. I am a certified nurse midwife and a psychiatric nurse practitioner. Have also dabbled in doula work and childbirth education over the course of my time, and I'm really grateful to be here to answer some questions and lend my expertise to this conversation.
Thank you.
Well, thank you. Before we get started, I just want to do a little disclaimer that, as always, anything Melissa or I say during this conversation or our guest should not be taken as medical advice. Please consult your own qualified healthcare professional for questions about you or your baby's health, and the opinions expressed during this conversation are personal to us and our guest and participants as well, and don't ever represent the views or policies of any current or former employer, including hospitals and clinicians. Our conversations or this recording is done on a HIPAA-compliant platform, and for a review of our disclaimer, please visit babiesincommon.com/disclaimer. And second, this video cast is meant to be interactive. So if you'd like to ask a question, just use your clapping emoji or unmute your video and wave or type your question in the chat box. So there we go. Next to you, Melissa.
Thank you, Jeanette. So today is May 6th, 2020, and we will be discussing getting help for postpartum depression and anxiety. And this is in honor of Maternal Mental Health Awareness Week. So and thank you, Jill Fieleke, for being here. Like she said, she is a psychiatric nurse practitioner that's working in Watertown and works specifically with perinatal clients. Because as she said, what's special about Jill is that she's been in the birth world as a doula, childbirth educator, and also as a midwife catching babies at a hospital, local to us. She describes her approach to mental health and psychopharmacology as patient-centered, holistic, and comprehensive. And she also has 2 teenage children. So today in our episode, we're going to hone in on Jill's expertise in caring for these perinatal clients. And we're going to learn about what mood disorders affect pregnant and postpartum people and how to get help for yourself or for someone that you love, and what treatment options are available for folks who may be dealing with these issues. So again, thank you, Jill, for being here. It's so nice to see you.
My pleasure.
I love the combination of what you do and how you came to it. Is fascinating.
I know, like what midwife is also like your psych NP, like that's the best of both worlds.
So I love it, but it was a lot of years of school and that windy path to make my way. But I wouldn't have it any other way. So
sometimes that windy path is what brings us to our best self, our best life, right? So that's exciting. Let's start off with the basics. All right. So many people have heard of the term postpartum depression, but they might not have heard of the term perinatal mood disorder, which is something that people in our field are trying to use more often. Can you talk about what that means and why it's an important distinction?
Sure. And this is an excellent question because I do think postpartum depression is thrown around as a phrase in the media. It's thrown around as a phrase in families and communities. It's thrown around as a phrase with even healthcare providers. And there are a vast majority of mood disorders during pregnancy and postpartum that are not postpartum depression. And I think I've had women take care of who said, it took me 4 months to come to you for care because my OB said, well, I think you have postpartum depression. And she said, but I didn't feel depressed. I didn't feel depressed at all. I felt anxious. I worried about hurting my baby. So that didn't make sense. And then I thought, well, maybe I didn't need care. So perinatal mood disorders are defined as any one of a number of conditions that come up during the course of a pregnancy or the first year postpartum. And that can happen with adoptive parents. It can happen with people who even lose a child over the course of pregnancy or postpartum. So it's pretty inclusive, and it looks at depression, but also bipolar illness, anxiety, obsessive compulsive disorder, which has a little bit of a different flavor in the perinatal period, post-traumatic stress disorder, and rarely, but terrifyingly, I think postpartum psychosis. So it is a much more broad and comprehensive way of looking at things that can be challenging during this period of time. And I don't feel like we've done a very good job of making that what's on everybody's list when we talk about this.
I wanted to ask too, like from your perspective, why would somebody who is pregnant or has a new baby think that their care providers, midwife, OB, family practice doctor wouldn't be the person to talk to about that?
Right, you would think that. Unless your provider were to just be honest with you and say, I'm so glad that you asked me about this, and I have to tell you, this is not my area of expertise. Let me connect you with someone who is. I think those are the people to whom it makes sense to talk. And also they're the ones that are most easily accessible, because typically you are having scheduled appointments with them, whether, and then with the pediatrician, you're having scheduled appointments. So the idea that you might have to work beyond that to find somebody who is going to be the right resource for you is a lot more daunting, and on a practical level, often much harder. So
I think a lot of people go into it thinking, oh, well, if I have this problem, then I'll just talk to those doctors or midwives about it, but they're not trained usually to handle that.
Yeah.
And so from my experience and talking to lots of couples over the years, it's very much that like they're almost afraid sometimes to talk to you about it because they don't know who to refer to, which is, I think, was understandable years ago. Now there's more resources, but it should be their job to figure out who to refer to, And I'm glad you're out there and that we can now know, everybody can know to refer to you and others like you. But yeah.
Well, and it's honestly part of why I evolved into doing this role, because even as a midwife who really had this interest and passion, I felt like I wasn't giving people good care and guidance, or at least not the level of care and guidance that I would have wanted to offer in the context of a 20-minute or 30-minute maybe office visit. And then I was also, stuck often getting people resources as well, even feeling like I was more connected to the community than the average OB provider, but even still. So we at this time, we don't have the space, the time, the space, or the expertise for perinatal obstetric care to be the place where mental health care happens. It's not set up for that.
That's so true. When I worked as an office OB/GYN nurse, there was many a time that a panicked MD or NP who was already behind schedule because they try to, these are very good, passionate providers who are trying to provide the best care that they can, are being asked to cram more patients in than is reasonable to ask of them. And then, everybody knows, in the biz about the, Edinboro Postpartum Depression scale, right? And they know to give it. You might have even gotten this at one of your prenatal appointments or postpartum appointment in the past, asking you about how you're feeling. And the problem, though, is, a lot of people know to give that questionnaire, but then when they get a positive screen, which means that someone is at risk for possibly having postpartum depression or a mood disorder, what do I do with that now? Like you were saying, Jeanette, and also I don't have the time because I have 2 or 3 or 4 other patients waiting in the waiting room for me. And I just already went over my 15-minute slot. Melissa, please figure this out. And then I'd be scrambling to try to get a a appointment for somebody within 24 to 48 hours, and I was coming up short. So at the end of this episode, we're actually going to talk about some real ways that you, if you are someone who thinks they might be suffering or love someone who you think might be suffering, ways that you can go about advocating for yourself to find that appointment. Because like you said, it might not be in the area of expertise of your OB, your pediatrician, your midwife, or your family practice doctor. But even if they do care very much, they might not have the resource to get you that quick appointment. How can you advocate for yourself? So if someone thinks that they might be suffering, let's talk a little bit about symptoms. Like, Jill, can you talk about like what symptoms might somebody who's suffering from postpartum depression be experiencing? And then also, can you talk a little bit about postpartum anxiety? Because I was one of those people who was told maybe you're suffering from postpartum depression after my first. Come to find out, I was suffering from quite severe postpartum obsessive compulsive disorder. And so when I was told maybe it's PPD, I was like, but I don't feel depressed. I'm just constantly consumed with intrusive thoughts of hurting myself or my baby. I laugh because it's like, it's so dramatic when I say it out loud, right? But, you know, I didn't feel what I thought was, you know, the Brooke Shields book in the 90s, When the Rain Comes Down, postpartum depression, right? So what types of symptoms kind of are classic to those two diagnoses, if you wouldn't mind?
Yeah. So there are such a variety of symptoms that can go along with either of them. I think you're right that the one that many of us have in mind for postpartum depression is the profound sadness, hopelessness, kind of not wanting to get out of bed, maybe not feeling connected to your baby, feeling like a bad parent, and crying all the time. And absolutely, those can be symptoms that go along with postpartum depression. However, there are versions of postpartum depression that look more like extreme irritability, and, you know, being unable to tolerate getting help from other people, sometimes being unable to sleep and feeling just kind of very revved up and keyed up all the time, angry. And, you know, then there are some people who feel very connected to their babies, and there are other people who do not. And I think that's a normal spectrum of postpartum kind of maternal-child connection. But it takes on so much more weight if a mom is struggling with a mood or anxiety disorder, because then there's this meaning of like, I'm not feeling as connected to my baby, and then like that means I am bad, and I'm a bad parent, and I'm never going to be a good parent. So for almost all women, with postpartum depression, there's a lot of shame and self-loathing and self-criticism. And, you know, to our credit, culturally, I do feel like more people are telling their stories and speaking out about it, and that I do think helps with some of the shame, but it doesn't treat the underlying illness. So postpartum anxiety and its special flavor of postpartum OCD tends to look more like the extreme end of the normal parental anxiety curve. Because of course, everyone who has a baby, even if it's your fifth baby, you're going to have worries about their safety in the world. You're going to have worries about, are they eating enough? Am I doing this right? For first-time parents, certainly much more so than for people who are having subsequent children, but can happen for anyone. For people who have postpartum anxiety, that worry and that level of anxiety expands to a place where it actually starts to impair their ability to, often their ability to kind of function normally in their home and in their relationships. It can impair their ability to allow others to care for their child, or even to hold their child. They can become very socially isolated because of fear of separation. What else?
You
Sleep
know,
becomes a really big issue.
that's what I was going to say. Sleep
The-
becomes an issue, and then sleep with the baby makes everything worse. It's like,
it is, oh my
it's just,
gosh, it is, it's such a puzzle. And I, you know, my caveat to every single person I look after is there is no mental health without sleep. So that is where we have to start as our baseline, getting the maximum amount of sleep that is possible. And there are lots of ways to strategize about doing that, even with breastfeeding families. But for moms who have anxiety, often they have trouble falling asleep even when the baby is sleeping. There's checking, waking up to make sure the baby is breathing, even again if the baby is sleeping. I have somebody right now whose baby is 8 months old, and she's still waking him every 2 hours to feed because she is convinced if she doesn't that he's not going to grow, even though she's been reassured by the pediatrician. And then this amount of disrupted sleep, of course, only cycles back to more anxiety, and then I see it cycling into mood as well. Just feeling like so overwhelmed that they can't manage this life with a new baby. Postpartum OCD kind of kicks that up a notch further. And postpartum OCD can happen in women who've had OCD in the past as a child or growing up, and it can arise completely independently in the postpartum period. And I think that is where it often takes folks by surprise, because their brain has never worked in the way that it is working now. And the way that their brain is working now is that there are so many thoughts that are happening all the time, and so many images and so many worries. And so it's really the obsessive piece of the OCD, not so much when we think about the compulsive cleaning or hand washing. It's the thoughts that are relentless and very hard to control, and quite often about either terrible things happening to their baby or a parent themselves doing terrible things to their baby. And these thoughts and images are absolutely horrifying and terrifying and shameful, and make most women worry if they're getting psychotic, because all they can think of is, if I could have this thought in my head, then I must be crazy. And if I'm crazy, that means I must be going psychotic. And then, down the path of what that looks like.
Well, I would imagine too that when you're in that specific space compared to anxiety and depression, it's probably less comfortable to even admit to a partner or a grandparent, like anybody in your circle, to say that you're having those thoughts, versus if you're sad or you're feeling worried about something, But also, just as an aside, isn't it also true that partners can also get all of these things?
They absolutely can. So it looks like about 10% of partners will have a postpartum mood or anxiety disorder. And that's something I like to try to do education with for folks when I'm doing a visit at around 36 weeks and sitting with the family and preparing for postpartum, to say like, hey, so, dad or partner, you are not my primary client, but listen, 1 in 10. So we're going to look out for you too. And some of these same things that I want you to pay attention to your partner, we're going to be looking at for you, whether you're able to sleep when the baby sleeps, what your appetite is doing, things like that.
It's interesting. It makes me think, like, sometimes I've been leading groups with new parents, pretty much is always the person who gave birth to that baby. But and sometimes it comes in that, like, oh, well, my partner won't do that, or my partner's not understanding, or my partner this, my partner that, like negativity. And I have things that I say or, questions I'll ask, but it's another aspect of it to think about like, oh, wow, well, maybe they're actually going through this. And maybe that's why they're behaving that way, right? Instead of just, oh, they're a jerk, or they're stressed about work, maybe they're actually going through a postpartum mood disorder at the time. So that's a good thing to add to that list of things to think about.
It is. And I think, I encourage, for my clients who have a separate therapist from me, I encourage them to bring their partner to a therapy session toward the end of pregnancy and also to some therapy sessions in the initial postpartum period, just so we can all get a handle on the family's health, including the health of the partner. Yeah.
That's good.
Yeah, it's exactly what you guys are saying. Part of the problem with these postpartum mood disorders or perinatal mood disorders, because as you've described, these can start for a lot of expectant people in pregnancy, is that the disorder tricks you into not getting help. And that was my experience as someone who suffered from postpartum OCD with my first. I was having these intrusive thoughts that I describe as a monster in my mind. It was somebody who was constantly replaying as if there was a vivid picture movie reel in my brain of my worst fears about my baby coming true. And so, for example, I would be walking down the stairs with my son holding him. And it wasn't just that I would think, which some people might just think, oh, what if I dropped him? It was that I would think, what if I dropped him? And then I would see in my mind's eye that he would tumble out of my arms and fall down the stairs and crash his skull open and blood would be everywhere. And I'm being dramatic because that's what was playing in my mind, right? I would be chopping vegetables and then I would think and I would see in my mind's eye the knife coming into my chest because I would stab myself or I would stab my baby, right? I'd be giving him a bath and I would see in my mind's eye that I would hold him down under the water, right? And I have to say that these things brought me such horror. I was so horrified by these things. And that's a hallmark of OCD. That's what my therapist, honestly, my savior, described to me. She was like, people who have obsessive compulsive disorder, who have these intrusive thoughts, these obsessive, horrifying thoughts, if you think you're going crazy, you're not crazy. Because people who are crazy don't know they're crazy. And I don't mean to say that lightly, but that's kind of how she describes it to me. Like, if you are worried that you're losing your mind, you're not, right? Because these were things that were my worst fear, right? What my worst fear was that my baby would die, that I would hurt my baby, that something would happen and it would be my fault. And I was feeling so terribly that, I was having these fears that I would hurt myself. But I didn't want these things to happen. So when people would say, like, are you worried that you're going to hurt yourself? I would say no, because I didn't want to die. Like, I was not suicidal. I would drive down the Mass Pike and I would have these vivid movie reel thoughts in my mind, these visuals of me driving my car off the bridge, right? But I was terrified of dying. So when people were like, are you depressed? Are you suicidal? Are you worried you're going to hurt the baby? I would say no, because I did not want these things to happen. And that's what OCD does. It preys on your biggest fears, right? Is that what you feel, you notice in your clients as well?
Oh, absolutely. And, and then of course it can cycle without checking in with somebody who's able to normalize and say like, oh, you know what? Like, this makes perfect sense. We know what this is. This is really treatable. This is not you losing your mind. This is really something that we can diagnose and work with. And we all know you're not going to hurt your baby and you're not going to hurt yourself. But unless you check in with someone and they're able to tell that to you, your brain just goes to the place of like, I'm a crazy person. The Department of Children and Families is going to come to my house if I ever breathe a word of this to anyone. If I tell my husband, he's going to leave me. If I, tell my parents, they're going to take me to the hospital. And I have to tell you, I have seen those things happen. And then sometimes I get people on the other side of it and we kind of tease it apart and I say, whoa, no, you are not. I know somebody told you were psychotic, but you weren't. Like, this makes really perfect sense. And it actually, the fact that you were so horrified by it just tells me what an incredible parent you are. Like, how desperately you wanted to do anything to protect your child. But postpartum OCD, I feel like, is poorly understood by the larger OB, even psychiatric community, honestly. So
It's so true. Like that's exactly what went through my mind. If I say this to Paul, my husband, if I talk to Jeanette, was my doula, actually, for those of you that have heard other episodes, she checked in with me quite often, and I was really good at putting on a front. I'd come to
Yes, you were.
class and I was great. And the midwives that actually you used to work with were caring for me during that pregnancy, and were checking in with me, and I was so terrified of admitting how I was feeling, because of two reasons. One, I thought they would absolutely take my baby away. I thought that if I'm having these thoughts, that they're going to take it. But the second thing is, I was so shameful. I was so shameful that I would be having these thoughts, because I was a labor and delivery nurse. Like, I went through 3 years of infertility treatments and 3 miscarriages to have this baby. I should be so grateful. How on earth, what type of horrible person would think these things? That's what goes on in your head, right? It's that self-loathing that you described. What horrible person are you that you would have these thoughts? You should be so grateful for this baby. You wanted this baby so badly. And if I tell this to these midwives, my doula, my friends, my family, they are going to think I'm a horrible mother and take away my baby. But, it was that therapist that I ended up connecting with that actually said to me, she said, Melissa, I would actually trust you to take care of my own kids right now. And I will never forget that. That was 7 years ago, but I will never forget that she said that to me. She was like, I would let you babysit my kids right now. I trust so much that you are not going to act on these thoughts because you are so horrified, and because you haven't acted on them, right? Like, that's something that a lot of people, if you're feeling this way, you don't have to. She said that to me. You don't have to feel like this. And it wasn't until I got help that I realized how bad I had been feeling. You get really good at just making it through the day, that you actually don't have to feel that bad.
yeah.
Jill,
And
I have a question though, first, before you move on to all this good juicy stuff. Is there a screening tool for, I know there's the Edinboro, and I know there's a couple others I can't think of the name of now. Actually, I just thought of, I think I heard that, isn't there a new one that includes OCD?
So there's a scale called the Y box, which is the Yale something or the B OCD scale, that is pretty good. It's a more general scale, not specifically geared towards perinatal clients, but it's a pretty good screening tool. I mean, I have to say, probably the best that we can do for ourselves, for our clients, for the people that we love and know, is to get them connected to providers who have this as a specialty. Because, and I know we are all going to do the best that we can, and I know that in different areas of the country that's more challenging. And I'm actually really grateful for the ability to do telemedicine and to make services more accessible to people nationwide. Because I feel like if you go, like Melissa, you went to a provider who knew exactly what this was and knew how to normalize it, how to bring you back from your shame, how not to, reflect her own worry. And people who don't have this as an area of expertise, I think, aren't equipped a lot of the time for that, because these are really scary, horrifying thoughts. And And I think, one thing that I have come to do, if I'm getting any vibe at all, or if even there's just anxiety, I will say, like, you know what, this may sound crazy, but I see a lot of clients who have some of the worries that you're talking about, and also have these thoughts or images that come into their head of terrible things happening to their baby, or even themselves doing terrible things to your baby. Is that something that, comes up for you? And just like having it come from my mouth in a way that says, like, this is a thing that I see, I feel makes it much more likely that somebody is going to feel okay about saying yes. But I don't know that there are as many providers who have that level of comfort talking about this, what can be a really scary issue. Yeah.
True. Sadly true. So earlier, before we started the episode, we were talking about how you do a lot of prescribing, and I know that's an area where, as a lactation consultant, as a childbirth educator, all of the things that I've been doing over the years, there's such a differentiation first between, like, there's a licensed mental health counselor, there's a PhD psychologist, there's a psychiatrist, there's a licensed social worker, there's all sorts of people. Then there's also women's health, psychiatric nurse practitioners like you, and some of them prescribe, others can just listen, and it's so confusing. So it's also hard, from what I understand and what I've experienced with my clients who I was trying to get help for, to find a prescriber. And I love that you're out there, and I hope we can find more of you out there, but just getting an appointment with a prescriber. So can you chat about, like, why that might be, and sort of who does what role, and why they would see you, etc.?
So another great question, because yes, there are a billion letters that people have after their names, and it's hard to tease out who gets to do what. So there are really only two categories of psychiatric specialists who get to prescribe medication. So one is psychiatrists, and the other is psychiatric nurse practitioners. And obviously PCPs and family practice docs, they can all do prescribing as well, but as far as kind of having a specialty. The other folks, even doctoral level psychologists, they are doing therapy or testing. Licensed social workers, licensed mental health counselors, licensed family counselors, they are all just doing therapy. So what I feel like is the great news is that we are really in a well-resourced state with people who are doing the therapy work and who have a specialty in perinatal mental health. And I am part of a listserv of folks that I love and trust, and we'll kind of talk about resources a little bit later, but there is a good group of folks for that. For prescribing, it's psychiatrists and psychiatric nurse practitioners, and the vast majority want nothing to do with pregnancy or lactation. They see it as a tremendous liability and risk that they have no interest in taking. And I honor that. I think what I struggle with sometimes is then the advice that they can give their patients as a result of their level of discomfort. But I also honor, if you feel like this is out of your scope of practice, then you should not be practicing it. So there aren't that many of us who have the interest, the expertise, I wouldn't even say the confidence. I mean, just feeling like we're all working with people. You're building relationships with people. It's not that different from everything else that is done in mental health. And those folks can be hard to access. Like the MGH perinatal psychiatry program is fantastic. It can take, I just had someone who booked 8 months out for a consult, and it's a consult and you see them one time, they don't do ongoing management. So they're a great resource in that they do take all insurances. They have some, world-class experts. But if you can get only one visit 8 months out, that isn't typically adequate for what most women need in the moment. There are a few other scattered psychiatrists around and some psych NPs that are doing this as their work during the perinatal piece. I actually just have two colleagues, one who was a women's health nurse practitioner who just got her Psych NP, and one who's a midwife who just got her Psych NP. So I'm hopeful that my field of colleagues is expanding in response to the need that is out there. And I think when you look at all the morbidity and mortality of the first year of postpartum and even of pregnancy, and the number of women that we are losing because of mental health issues, it is incredibly distressing and should hopefully help make this more of a public health issue where there's more awareness of needing these services, that they can't be that you can get an appointment in 8 months.
That's the longest I've heard. I remember a few years ago at UMass, they used to have a women's mental health. I think it was just women's mental health. I don't think it was maternal specific, but it was a great program. There were several psychiatrists there that were well known in our areas, being very good at what they did. And then it reached a point where I was hearing people go, well, they can't see me for 3 weeks for the initial intake. And that seemed like a long time. And then it's like, oh, it's 2 months. And you're like, you're thinking thoughts of suicide. Like, you need to get in there. And then they're like, oh no, they shut that down. They closed that building and now they moved them. And you're like, now there's one provider, and it was in a department that was already crazy booked at a major medical center. You would think, one would hope that you could say, hey, we've got 6 new positions for psychiatric support people, care providers, and that doesn't happen. And I also, from what I understand from a psychiatrist resident, I think she was, that I was getting to know at one point, that she said that there's not a lot of people going into that field in the first place. Is that right?
Yeah. And, I think there are more fellowships that are being developed and kind of marketed to make them more attractive to psychiatrists who are coming out. But I mean, unless it is your passion, you would not need to do it. You can get out of your adult or pediatric psychiatry residency and have many jobs and make a lot of money. So
isn't that the way?
Wow.
So that's a great segue into getting help.
Yeah.
So if somebody feels like they or someone they love is suffering from one of these perinatal mood disorders, what is the first step in help? Because a lot of people think it's medicine, but it's not, right? It's therapy. So how would they find a therapist, especially knowing, as we've discussed, that their OB provider or their pediatrician or their PCP might not have a resource list of people that are available to help them? What would you recommend for people for that first step?
So PSI, which is Postpartum Support International, their directory is actually now online. So everyone in that directory has taken at least one of their courses and identifies themselves as having an interest and some specialty in perinatal mental health. There's also it's not a licensing exam, but there's a credentialing exam that they have now that even kind of further pulls out the experts. So you can search nationwide, actually worldwide, by region and what you're looking for. You can also use it in pregnancy. So it's not people who are just looking after postpartum clients. So if you are in your 4th month of pregnancy and feel like things are starting to fall apart, there's still a good resource.
Yeah, and that's postpartum.net. But honestly, that's the resource that I had found to get help. And I just literally typed in Google, I think I have postpartum depression. Where do I get help? And like, that was the first thing that came up. So hopefully it comes up even on your Google search. What's funny, and I'd like to make a note, not funny, but funny in hindsight. The first person that I had found through Postpartum Support International was actually a terrible therapist. And what I mean by that is And I don't know, Jeanette, if you remember this, but I met with her and she had lots of credentials in this area. But when I explained to her that I was a breastfeeding mom and I was struggling with sleep, as we've talked about, and having all these intrusive thoughts, she had many good things to say. And one thing that I take away from that appointment that I had with her was she talked about a red, yellow, green light system of talking to my partner about how sleep deprived I was feeling. She was like, right now you're in a red light level of sleep deprivation, like red zone. Like you need to stop and get sleep. Like this is not something you can sustain. And if you need me to meet with him or talk with him, this is critical that you get some more sleep. So that's one thing that I took from her. But she also said, you need to quit breastfeeding because that is the cause of all of your problems.
But
and
what's even crazier is that she's also has a history of breastfeeding herself and being involved in La Leche League. And so
that's exactly what she said. She was like, I breastfed my kids.
Supportive.
Yeah. She was like, I breastfed my kids. I understand that
you were not the first person that I had heard her say that to. So then I was like, okay, we need to stop referring to her, unfortunately. But
she's like, I breastfed my kids. I'm totally breastfeeding supportive. But you've got to give up breastfeeding because that is what is causing all of your problems. And of course, breastfeeding was very important to me. Like that was something that was, and so, but I was desperate. Like I knew that if I did not get help at that point, I hope that anybody listening to this podcast gets help way before they hit this point that I hit. But I was at a point where I was either going to, swallow a bottle of Tylenol or like divorce my husband. Like, I mean, it was like that extreme. Like I felt so terrible. And so, I called Jeanette, who was my doula, and it was 10 months postpartum too. So, anybody, even if you had a doula for your delivery, like she could be a resource for you. I was like, Jeanette, if you tell me right now that I have to quit breastfeeding to get healthy, I will. But I need to hear that that's what the right thing to do. And thank God for Jeanette, because she was like, I'm not going to tell you what you need to do for your life, but there are many other providers who would not have given that advice. And so she's like, just try one more therapist. And so I went back on postpartum.net and I found one more therapist, and I was like, okay, I'm going to make this. If she tells me that I have to quit breastfeeding, then I will. And she didn't do that at all. And she was what I joke as my, my saving grace, my angel. She was the one that diagnosed me properly with OCD.
And meanwhile, like me and many other doulas have resource lists for you, but oftentimes and I don't remember specifically in your case, but oftentimes I'll say like, oh, well, there's a list on my website. And you're like, yeah, I called them all. They don't take my insurance. I can't afford to pay out of pocket. And all of them are already booked up anyway. Right.
Yeah.
So it's like, I can't always keep up as much as I'd love to with every single provider every single provider type. And then each one of those providers of all the kinds of things that I want to refer for my clients, because there's so many great different types of providers out there. But what I love too about what you said, Melissa, was that even though you had a hard time with that part of the advice, you still got some valuable knowledge from her.
Yes.
And so it's not, I think sometimes we discount so much of what someone says when actually they had a lot of other good stuff to say too. So
yes, she did. She had a lot of good other stuff to say. And that's what I tell my friends, my clients, my patients. I tell them, like, if you get over that initial hump of even getting to the therapist, which, unfortunately there's so many barriers to that, right? If you don't jive with that first person that you talk to, like, don't give up. Everybody has different personalities. And so you might, I hear some people say, I tried therapy once. I'm like, oh, honey, you got to try it more than once.
Inevitably, the first one's not going to be the good one,
I mean, you might have had a boyfriend or a girlfriend and they didn't work out. You didn't just like give it all up, just like swear off love for life, So, don't give up. And there's so many barriers, right? Like, well, I've got the baby and I've got to put real pants on and I've got to get there and I don't have a car. One silver lining to the pandemic is so many people who otherwise didn't do telehealth are now telehealth available. So, wow, what a great
and you literally not only can have your baby with you, which a lot of the providers will.
Yes, they will. That's another point.
But you literally don't have to put on pants or a skirt to do the telehealth.
Right.
Am I wearing pants right now? We don't know. We can't. The beauty of it.
The
Exactly.
So I do feel like one of the things that has come out of this COVID pandemic is that mental health has really caught up with the 21st century, and almost all therapists have developed an online platform for seeing clients. And there are so many more parenting support groups than there were before. I love it. Like, a lot of social workers who thought like, oh, I want to run a group, but I don't know if I'm going to be able to find a space, like, have just started groups. And so pretty much every day of the week, several times a day, if you, as a parent at home, or some that are, for parents of toddlers and who are currently pregnant, there is a place to check in. And all you have to do is click on your screen. And if you are in Boston and the group is in West Boylston, that's fine. All you do is click on the screen and then click off when you're done. And those communities I've found to be really helpful to people and a good way to get resources, to ask around in your group, because you got to know somebody else in your group, whether or not they are talking about it, is struggling with a mood, anxiety, post-traumatic disorder, and they've thought about it, or their sister used somebody who they really liked. And so that word of mouth from people who are families in the same boat, I think, is a great way to get some resources. A lot of people find me through like Somerville Moms Facebook group, and in the same sort of way that someone puts out there, I'm really struggling. I'm looking, for a therapist. I'm looking for someone to talk about medications. And then, the group responds. And I feel like you can even put yourself, even if you're afraid to say very much, you can put yourself out there in a very limited way and still get people who will reach back out to you with ideas.
Absolutely. Postpartum Support International not only has their website where you can search the directory, like you said, but they also have a warm line, which is actually what I used. I called it, and you leave a message. Warm line, a hotline is they'll pick up right away. A warm line is they usually return your call within 24 hours. And they helped me find, they took my zip code down, they did the search with me and helped me find someone. And I don't know if you agree with this, Jill, but something that I've used as an OBGYN office nurse and beyond is the psychologytoday.com therapist finder. Awesome. So what that is Psychology Today. If you just look that up, .com, there's a little button that says find a therapist. And what's nice about this button, it helps with Jeanette's issue that she had brought up. You can use the filter to filter just people that do perinatal mental health or pregnancy postpartum issues or infertility or whatever, right? You can click off your insurance. You can click if they're a man or a woman. You can click all these different filters and then search in your zip code. And I have personally found that the social workers, licensed mental health counselors, and other types of mental health providers that I found by doing this with patients of mine are way more vast on that website than even a Google search, right? Or even a list that someone might have that might not be updated. Because there are so many providers that just might not have gotten on that Google search engine, that might be there. And so that's another option as well, because you can click off just people that accept your insurance or whatnot. Because
I have only one caveat about that. And I think Psychology Today is a great resource. When it pulls up your list of people that's filtered for perinatal mental health, I would look that they have that among kind of their top 3 things that they do, because some people click off, they give you 60 options, and some people click off 30 of them, and one of them is maternal mental health. And I feel like that person may not be the best. That doesn't look like that's their specialty, even if they like it. But if you click on someone and they have, maternal mental health, perinatal health, fertility, depression, anxiety, that's a good place to start.
Yeah. So when you click on their name, they'll be like their picture, and then like they can describe themselves. I would definitely recommend reading that.
Yeah.
And then the best part about that is some people are very intimidated by making a phone call. But what's great about therapists is they never pick up their phone anyway because they're always in session. And so, A, they probably aren't going to pick up a live call. If you did call, you could just leave a message. But B, you can email them either with their email address or through that website and just put something as simple as, you don't have to go into detail. My name is Melissa Dubois. I'm 5 weeks pregnant, 5 weeks postpartum, or I'm 37 weeks pregnant. I think I'm suffering from, insert here, anxiety, depression, OCD, or I'm just not feeling well. I have Blue Cross Blue Shield insurance. I'm available on X times or X days. It might be that you have large availability. I'm available any day or time because I'm on maternity leave for the next 12 weeks, 6 weeks, 8 weeks, 2 weeks. My email address is this. My phone number is this. Are you available to help? If not, do you have any recommendations? Just email it. Just send that form letter to like the top 3 people you like their picture.
Mm-hmm.
So
the other thing I wanted to add about that resource is that it has pictures. So when I was looking for a therapist many years ago, there was something about like, I want to see, what does this person choose to represent themselves? And do I see something enticing and warm about their face? But then I would read that description and like, what else are they passionate about that may not have anything to do with me, or what's their experience that just goes, oh, I have that in common with them. Or I know they're interested in working with this type of population, which is a population I care about, not really related to what I need you for, but it made me feel like if I mentioned something like that, they'd be open to it, you know? Which was helpful.
there's definitely lots of therapists and lots of personalities and lots of people that could be a good fit for you. So like, don't give up. Like I said, even if you have one bad experience with therapy, you know, I hear people say all the time too, oh yeah, I went to a therapist when I was in high school or college and I didn't like it, you know. Well, don't give up, because postpartum perinatal mood disorders are the #1 complication of childbirth. That's something that, you know, should be a striking statement, right? We hear about emergency cesareans and preeclampsia and gestational diabetes and all of these things, but perinatal mood disorders is the #1 complication of childbirth. 1 in 5 expectant, you know, birthing people is going to suffer from one. 1 in 10 of their partners is going to suffer from one. Up to 50% of people living in poverty are going to suffer from a perinatal mood disorder. These are striking statistics. So it's not something that happens to just other people. It's something that can very much happen to you or someone that you love. And this is kind of what my feeling about it is, a lot of times people get hung up on, well, is it the baby blues or postpartum depression, right? Is it the baby blues or postpartum anxiety? And I'm thinking, like, if you're suffering at all, who cares? Just get help. Like,
Absolutely.
is it really depression? It's like, but if you're even thinking that, like, is it gonna hurt to talk to an expert a couple of sessions? And you know, you had mentioned, Jill, in our meeting before this podcast, like talking a little bit about COVID-19. There are a lot of people that might not have a diagnosable mental illness that are struggling with being pregnant during a global pandemic. Like, why not give yourself a couple sessions with someone that is educated and experienced in helping you work out these feelings? There's no downside, right?
I couldn't agree more.
The other area that I see it helpful related to pregnancy is that as you're coming into your birth, there are things about your person and your experience and what you think and your mental health, even if there's not a diagnosis that you could get, but you're worried that a past experience or a certain word or a certain action or a man entering the room, you know, there's certain triggers that are going to, you can acknowledge or work with your mental health provider about, how do I handle that if that comes up? Or how do I communicate this with my partner even, so that they can help watch out for me? How much do I need to say to the care providers during my pregnancy and my labor and my birth and postpartum, so that so other people can learn what not to do or what not to say to help support you?
And I like to review with people, again, towards the end of pregnancy, that, there are also risk factors that we know increase the chance of someone having a postpartum mood or anxiety disorder. And yes, some of them are if you've had one in the past or you've had one in pregnancy or a strong family history, but also a traumatic birth, an unexpected C-section, a baby who initially has trouble, difficulty with breastfeeding. I mean, that there are things that can happen even in the 48 hours around the time that you are laboring, birthing, and coming home that can set people on the foot to mood and anxiety disorders and trauma disorders. And to kind of preview, hopefully none of those things will happen to you, but if they do, like, I really want us to be in touch even more. Like, I want to make sure that we get to talk about that and not let that get you stuck right from the beginning.
I just took an excellent webinar on birth trauma, and it was a being trauma-informed care for labor and delivery nurses, basically. And one thing that I learned that I didn't know is if you have had a traumatic birth experience, for example, whether that be past trauma that has been re-triggered because of the experience, or just that it was a traumatic birth experience because of just an emergency that happened or the way you felt you were treated, whatever the reason, some people just want to not think about it anymore. But if you can talk to someone that's trained in helping you work through those feelings, you can help that memory be processed in a way that it doesn't become basically PTSD, right? Because when our brains experience trauma, it processes that memory in a different way. It walls it off and makes it so that when it's triggered, you relive it the way that you experienced it. I didn't realize that about trauma, that processing it with someone that's expert in doing so as soon as possible afterwards helps you not suffer days, weeks, years in the future. So don't wait to get help if that's something that you experienced. That could be a whole other podcast, birth trauma. But any thoughts on that, Jill?
So I absolutely agree. And I think the salient point that you said was soon, because we know that trauma really does start to integrate into your psyche fairly quickly. But that there is this window of time that, maybe a few days up to a few weeks where it is possible to sit with somebody and help them integrate the experience in a different way. And to find ways to frame it to their strengths. And that's why this, one of the things that I really struggle with now with so many practices only doing 6-week postpartum visits, so many, even before COVID, so many that had gotten rid of the 2-week visit, is by the time you get to 6 weeks and you maybe have a chance to talk to somebody, you are so far past the period of time where it might have helped to really be able to process your birth trauma or process getting this baby on the breast and what that looked like. And so Melissa, with you doing some postpartum visits,
exactly.
I think with my colleagues who I am hopeful are going to be developing practices like mine. I mean, what I do, I see the family at 36 weeks for a preview. I have them call me from the hospital and send a photo. We set up a video visit within the first 5 days and another 1 week later. And then as often as we need to, because this is such a vulnerable time. And I do feel like that's the level of support that many of us need in this period.
I agree. What a great way to take that barrier away, right? Like, because of my experiences with my first, when I got pregnant with my second, I had a therapist. So we made appointments for like the couple weeks after, like leading up to and after my due date, so that when I had the baby, I already had those appointments in my calendar. and if I couldn't make it because I was in labor that day, she understood. But it was one less barrier. So if you're someone that thinks that you are at risk of developing these things, especially if you have a history of anxiety or depression or OCD or any other mood disorder, bipolar, history of trauma in any way, shape, or form, meeting with a therapist while you're pregnant, even if you feel good, right? Just like establishing that connection before you're sleep deprived and leaking milk, your bottom is sore, and all of these things, is a great way to just stack those cards in your favor. One less thing to worry about because I already have made that connection with someone that can help me when I'm vulnerable and tired and sore,
And I think, like you said, Melissa, you may not connect with the first person or the first couple of people. And so if you are in the postpartum and just trying to get through your days, you are not going to have it in you to try to meet with 3 different therapists. But in pregnancy, when you're okay and you're just trying to be proactive, planning into the postpartum, you might have a little bit more in you to do the work that needs to be done to find a good person for you, if you should ever need them.
Right. Another question I had, which was actually a barrier I hear a lot when I bring up maybe that someone would benefit from a therapy appointment is, well, I don't want to go on medication. So, would you talk a little bit about that fear, first of all? Not all people need medication or, choose to take it, but also if medicine would be something that is helpful to them, can you talk a little bit about the safety of medication for anxiety and depression in pregnancy and with lactation?
Absolutely. So I do not think anyone worth their salt would tell somebody to jump to medication prior to therapy and a lot of other possible interventions to help someone feel better. In fact, even for me, where a big part of my job is medication, I feel like an equally big part of my job is to figure out what resources that mom has, what she's able to tap into, what she's not able to tap into, who are her people, what's happening with her sleep, what relationships does she have that are supporting her? Because ultimately, while medication is a tool, all of those other things are more important. And at its best, medication works to help be able to make those other things more robust and work better. So my goal in medication kind of assessment is figuring out, does someone actually really not need this? Even if their therapist maybe said, oh, go talk to Jill because I think maybe this could help you, or their OB said, go talk to Jill. I feel like a lot of what I'm doing is assessing out this may not be the right tool for this person or the right tool right now. And I think most therapists feel that way too, that they don't feel that medication is kind of an ultimate fix everything solution and will push you in that direction. I think, some psychiatrists do feel more in that way. I think having a nursing background for me does change the way that I have relationships with people. And I think what's really important is that whomever you're working with as a therapist or as a medication provider, that they honor you and your decisions about what you put in your body and the choices that you make for yourself and for your baby. That ultimately you are the one who decides, because that's absolutely true. And you have the autonomy on this. You also deserve, education about what we know of the risks of, say, untreated mood and anxiety disorders in pregnancy and untreated mood and anxiety disorders in postpartum, as well as medications in pregnancy and medications in lactation. And these conversations are actually fairly subtle. And I worry about sometimes conversations that will happen, sometimes with OBs, but even with other professionals, where they're kind of like, better not to be on medication because medication is bad. Or, that's category C. We actually got rid of the categories 5 years ago, but people still use category.
Yeah, thank God, because they are very misleading.
But I had someone who came up to me the other day who just had a consult at Harvard Vanguard with a psychiatrist, and she said, no, she told me that was C, I shouldn't take it. And I said, C, that doesn't even exist as a, so,
And I hear all the time as a lactation consultant, people telling me about once a week, whether I know them or not, I was told that I have to pump and dump, or I was told I have to quit breastfeeding for this medication. And I always say 99.99999% of the time, you're so wrong. And I don't care what letters they have after their name, they're almost always every single freaking time wrong. And I want to get the evidence to the parent and then to the care provider to help them make that decision and never say that again. But it's just so unfortunate because sometimes medications are really helpful and they're not going to be a problem with lactation for your baby or for your milk supply, one or the other, you know?
And my psychiatrist just told me to pump and dump the other day.
Oh gosh. Well, I'm glad you're here today.
Thank you for, I'm glad you're here today because as Jeanette always says that I say, it's almost never the case that you have to pump and dump. It is either that the medication is compatible with lactation or that there is a safe alternative. Like it is almost never the case unless it is, you know, a chemotherapy agent.
I was going to say something radioactive,
so.
Right.
Right. Yeah. That being said, Jennifer, I can't answer, neither Jill nor I can give you clinical advice on this call. So if you message us, then we can take that conversation offline and get you the right information.
Yeah. Okay.
Yeah. Can you talk a little bit about why many like SSRIs, for example, selective serotonin reuptake inhibitors like Zoloft or Prozac are compatible with lactation, for example, or pregnancy?
Sure. And what I want to let everybody know too is that we have more data, so much more data on these medications in pregnancy and lactation than we do on any other category of medications in pregnancy and lactation. More than blood pressure meds, more than thyroid meds, more than, gastric meds, because so many women of childbirth age are taking them and either choose to stay on them when they get pregnant or inadvertently get pregnant and then breastfeed. So the data that we have on this is not skimpy. It's not case studies. It's been collected in some cases for 30 years at this point.
That speaks volumes, right? Because how many doctors would hesitate to prescribe a thyroid medicine or a blood pressure medicine for someone who is
an antibiotic,
right? But we have to remember that just like untreated blood pressure issues and untreated thyroid disorders have consequences, so does untreated mental health conditions. That's the thing. It's like when a provider, my drug is approved, is VPAC to have risk, but they don't even mention the risks of a repeat cesarean, which also has risks, right? So yes, there is a potential for risk in any medication that you take. There is also true and documented research-based risks to untreated anxiety, depression in pregnancy and in postpartum times. We have to acknowledge that. Absolutely. To mothers, partners, and their children.
Absolutely. And some with long-lasting implications on kind of child attachment and child development. And so... And some of it mostly, I think, is this fact that, most providers are squished into these 15 or 20-minute blocks where there is not the space or maybe the desire to have these nuanced conversations. And so it winds up being a pump and dump conversation, or this is category C, or better not to take medicine, and not the let's look at this picture of how you can be well. Because you for this pregnancy to go well, for this breastfeeding to go well, you need to be well. And let's look at what tools they are. And there are medications that can be used as tools. So we have a ton of safety data on the SSRIs. They have been around 30 years, both in pregnancy and in lactation. Zoloft is often used for breastfeeding moms who have postpartum mood or anxiety disorders because it passes through breast milk in small and sometimes undetectable amounts. However, our first choice is whatever has worked for someone before, because all of the SSRIs are compatible with breastfeeding. And the SNRS2, the Effexor and Cymbalta, even though there is less data on them, they're all found to be compatible with breastfeeding. Zoloft is nice just because the baby gets the least amount. But ultimately, our goal is not just getting the baby the least amount, but getting the mom well so that she is able to care for herself and care for her baby and have the stamina to maintain that nursing relationship and the desire to want to maintain it. So if Zoloft is not indicated for some reason, it also doesn't mean there are no other options. I've had women come to me and say, like, yeah, my doctor gave me Zoloft and it didn't work, and so they told me there was nothing else I could take.
I want to pass on a story that I always like to share about medicines and breastfeeding. I know somebody for a long time now who knew her when she was pregnant, and she shares this story publicly, but I'm not using her name anyway, that she has been on lithium, and she was on, I believe, a low dose during her pregnancy, I think. Or maybe she went off, what, I don't even remember now. But postpartum, the question was, she really wanted to stay on lithium because she knew that that was the one, she tried so many, that was the one that worked for her. And she went to multiple psychiatrists. She talked to her midwife, her OB, like everybody was saying, no, until she found one psychiatrist that was like, well, yeah, let's look at what the reasons are behind the recommendation to not choose this as your first choice. And it was issues with the baby's liver. And so she talked to what she thought was going to be her pediatrician, and the pediatrician, because, then she's talking to me about it. I was like, yes, let's figure this out. We were like, well, can your pediatrician monitor the baby's liver and see how the baby's doing with it? And she talked to the person she thought would be her pediatrician. That person said, no, I'm not doing that. So I said, well, I know another pediatrician you can ask. And now she sees a pediatrician who when the baby was little, monitored the baby. And they did use a little bit of donor milk early on when the baby was young, because that made the dad feel more comfortable. And it was local donor milk, and he pasteurized it on their stovetop because he thought that was important. And it, can be, but he was like, that's my thing. And she's like, I don't really care about that. I know these people who are giving me the milk, but if it's your thing, you can pasteurize it. So he did it. And she ended up getting to a place where she could breastfeed 100% of the time with her own milk, and still is on lithium today, years later. So, it was just such a success story of a medicine that's labeled as, like, you were talking about categories, like in the lactation categories, it's like, no, don't do it. And she's successfully done it, and the baby's thriving, and she's doing well. So.
And thriving with a mother who can be present and healthy for her baby. That's important. Like, you matter. If you're listening, if you're watching, like, your health matters. Healthy mommy, healthy baby, we say, like healthy parent, healthy baby. There's something really very much to be said. That funny story. I am a kind of a worrywart in many ways. In other ways, I'm laid back, but in other ways, I'm a worrywart. And my grandmother, when I was pregnant with my first, she has since passed away, but she was like, in her 90s, she was like, if you worry too much when you're pregnant, it gets into the milk and it affects the baby. You gotta relax, And like, it's funny because that's not true, but also it's kind of true, right? Like, if a mom or expectant parent is high anxiety, high cortisol, high adrenaline all the time, like, it does have effects on our baby. It's not that it gets into the milk and makes the baby anxious, but I laugh when I remember that story, that old wisdom, right? That old school wisdom of, like, take a chill pill, Melissa. You gotta relax because it's, for the benefit of your baby, it's just a funny story, but. So actually that leads me to Amanda's question, which is, if you are concerned, we've talked about, like, if you are concerned about yourself, you can go to these things, but if you have a concern about a loved one, your partner, your daughter, your friend, how would you recommend, Jill, that they start that conversation? Because it can be kind of awkward to start that conversation. What do you recommend?
So, that's a great question. I think it is important to first check yourself. If you are coming into this with any preconceived notions, any judgments that may be there, any of your own personal desires to see things turn out in a particular way. Because I will tell you, as a postpartum parent who's feeling sensitive and vulnerable, you're going to feel that whole agenda. So I think it's important to kind of be clear about where you're coming from, so that you can come from a place of true kindness and compassion and I love you and I see that you're struggling and I want to help and I don't know the best thing to do. And, see what gets offered out of that conversation. And then ideally be in a place where you can say, hey, I listened to this podcast, or I went to this webinar, or I had a friend, and I know that there are some of these resources out there. And if you want me to help you get connected or go with you to an appointment, I would be so happy to do that. But I do think the first piece is checking in, because it can be with yourself, because especially if it's someone that you really love or are very close to, you may have your own incredible compassion, but also your own frustration that she can't seem to be taking care of this herself, or that you're having to do as much to take care of the baby as you are, or so to know what you're bringing to it, and then just to offer your observation and your love and compassion. That's my best idea of how to approach it. And if you want me to be more specific, I can try to be more specific.
No, I love that.
I love that. Yeah.
Something that I have used in the past, and I learned from the Every Mother Project, which I highly recommend. Anybody who is in a profession that works with expecting and new families should go to this website. It is a free toolkit that's probably about 12 pages long that gives you real phrases and things to say. Whether you are a doula or a massage therapist or a dental hygienist who works with people who are expecting babies. Many people in our community interact with new families but don't know what to do if they're worried. And so one of the things I learned from the Every Mother Project was normalizing these sad and scary thoughts and feelings, right? So, not just saying how are you doing, right? But maybe how what did you eat today, right? How much did you sleep yesterday? Asking those kind of concrete questions, but also things like, many new parents don't feel blissful right away. Like, how are you feeling? Just kind of putting it out there, because if you say isn't it the best? Isn't having a baby just so wonderful? That just shuts down anybody that might be feeling less than ideal, So, some new parents have really scary thoughts about hurting their baby that really are upsetting to them. Are you having any thoughts like that? And even if they don't admit it to you, you can just kind of plant that little seed of, well, if you do, there's a really great website called postpartum.net that, has some good resources. Just planting that seed can be helpful, because they might not get help that day or that week or in a couple weeks, but maybe one day they do. So I think it's important. I think, that's why people may say, stop talking, Melissa, but I talk about my experience all the time, because I think when it's somebody in real life, it's one thing to read a book or see somebody on TV, but when I'm hi, I'm Melissa, I'm your nurse today. And I suffered from postpartum depression and anxiety. So it's I'm a real person. I mean, I don't really actually say that when I introduce myself to somebody, but I'm this same thing I do with donor milk too. It's funny when I talk to parents in the hospital about using our donor milk, I'm one option is to give your baby formula, but another option is human donor milk. I even donated my extra milk because I had extra. They're oh, you're a real person that isn't a weirdo that's talking to me right now. And you just said you gave your milk to the milk bank, so that's pretty cool. Okay, yeah, I'll try it. It's normalizing these experiences, I think, is important. Jill, do you have any last thoughts or comments or anything you'd like to share with our listeners?
So what I like to tell almost all of the women and families that I looked after is, you are in great company. I know that this is so isolating, and you can feel so lonely and so ashamed. And I have got to tell you, I know the most incredible group of human beings who you would ever meet, who are working on all of these same things that you are. And so just remember that we're going to all just keep working on this together, and that there is nothing wrong with you, and this is not your new normal. You're going to feel better than this, and life is going to be different. And then sometimes, depending on where they are, I nudge them a little and say, and I'm going to want you to tell your story at some point when you're ready, because we all need to hear it. 1 in 5. I mean, 1 in 5 of us. So we all need to hear the stories, and not just the Brooke Shields stories, but the rest of them.
You are in good company. I love that. I think that's a great end.
But you know it. Like,
yeah.
Right.
This is so awesome, Jill.
Thank you. I love this. I love that I get to do this work, and it's so fun to be here with you guys today. It really is.
So before the whole pandemic and telemedicine became so popular, I know there were some therapists that were doing telemedicine. Were you doing that then too?
I was, and that was a platform that I took on really just because I saw so many pregnant and postpartum mothers, and I wanted to make sure we were always able to access each other. And it was great. One of the first people I saw after I set up the system was somebody who had her baby at 32 weeks, and we did visits from the NICU.
Wow.
And, you know, somebody who wasn't going to be able for the next months to possibly get to my office.
Wow.
Or folks who are home on bed rest, which really, as Melissa knows, isn't a thing that we should be doing anymore, but they can also have, you know, we can also do visits, or if the weather's bad and they can't drag their baby out. So I've always offered both.
And
we'll
you bill
continue to offer
insurance,
both.
is that right?
I bill insurance, yep, and insurance covers it. You pay the same copay as you would for an in-office visit.
Wow.
And right now, all insurances are covering it. That wasn't true prior to COVID, although most were. And the hope is that that will just continue, that it will be part of something every insurance will offer to their clients. So, yeah.
Yes. Thank you so much.
So please feel free to reach out to me. So my best email address to get me at is Jill Fieleke, which is first name, last name, JILLFIELEKE at Therapy Secure. And that is an encrypted confidential email. I'm also, like I said, I'm part of that perinatal mental health community. And so often what will happen is I will hear from somebody saying, oh, my sister lives in whatever, Mendon, and she's 3 months postpartum. Can anybody find a therapist? And I can put that out to my group and hear back, oh, yes, here's this person who lives here, who takes Blue Cross and is taking new patients. So I'm happy to connect people to resources that way as well.
Awesome. Because just in case people listening are thinking, so you're not doing therapy, you're doing mostly visits for prescribing medication.
I am. Although I will tell you that even that has a bit of a therapy thing, just
Sure,
because visits are never less than half an hour, and they're usually more like an hour. And so this is, the midwife in me. Like I want to know people. I want to know their families. I want to know their stories. So I always recommend that people have an individual therapist as well, but I'd like to be an integrated part of a team, and where I feel like I know my people.
That's awesome.
And, yeah.
Great. Melissa, anything else on your side?
No, I think
All
this
right.
was a wonderful end to our episode.
Yeah, thank you. All right. Well, that was great. So thank you to our folks who called in, and to Jill. And you can find Jill also at Jill Fieleke. Say it again. Jill.
Jill Fieleke.
JillFieleke.com. And if you or someone you love might be suffering from a perinatal mood disorder, you can also go to postpartum.net like we talked about, or you can call or text their warm line, all of which is on their website. And we hope you will keep in touch with all of the different video casts and podcasts that we're doing. They're all up on our website or on Spotify or Apple Podcasts. And we have another one coming up next Wednesday, is May 13th at 5:30. And we'll be discussing vaginal birth after cesarean with some local moms who had to advocate for themselves in pregnancy and labor to get the birth that they ultimately wanted. So we hope you'll join us for that.
Yeah, that's going to be a great episode, because even if you are not planning a VBAC, these moms had to advocate with their providers, sometimes switching providers, to find someone that would support the birth that they were wanting. So there's a lot of great information that we're going to talk about in that episode, whether or not you've had a prior cesarean. And like I always said, if you've learned even one teensy tiny morsel of helpful information today, don't be stingy. Please text a friend who's either expecting or parenting and tell them about us. And if you want to laugh your maternity stretch pants off while learning about childbirth, babies, and breastfeeding, please consider taking a live interactive Zoom class with us while quarantining at babiesincommon.com. You can get all that information about our classes, support groups, and virtual lactation consults. Again, if you like us on Facebook, we're always posting excellent videos and articles and resources to help you rock your birth and thrive as a new parent, because we are a community for you. After all, we all have babies in common. Thank you so much, everybody. Have a wonderful
day. Thank you. Thanks, Jennifer.
Bye. Thanks for our callers, Jennifer and Amanda. Thank you.